Hi, welcome to the Body Shop Physical Therapy. My name is Catherine Price and I'm a physical therapist. Today I'm going to go over the Egoscue Method for chronic foot pain. So this is for things such as plantar fasciitis, Morton's neuroma, bunions that are painful, or just bunions, so foot deformities or postural problems in the feet. Before I begin, I'm going to speak a word of life from John 1:16. From his abundance, we have all received one gracious blessing after another. Amen. So this is going to be the menu for feet. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. The things that I'm going to be using today are going to be an ottoman, a regular chair. I do have a block that I'm going to use. A pillow will work too. And then I am going to use a strap or a dog leash, and I have a timer. So you can follow along with me and I'll take you right through this menu of exercises. The first one is going to be sitting heel raises with block. So all I'm going to do is begin by sitting at the edge of a chair or having my thigh a little bit supported. I want to imagine that I've got an eggshell underneath my toe, and I'm going to place the block between my knees, and I want to lift my heels using my hip flexors. So I'm just going to lift my heels off the floor, but I'm going to pretend I've got a eggshell or an egg right under my toes, so I'm not putting much pressure, and I'm using my hip flexors to lift. So I'm going to do 3 sets of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'm going to keep pressure to hold the block. I want to keep my shoulders down and back, so I'm going to keep good posture but keep the arms relaxed. Another set, squeezing the block and lifting. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And take a pause, deep breath. Good posture, holding the block. Last set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Next, I'm going to do short foot. So for this one, what I'm going to do is stand with my feet. They're going to be hip width apart, so keep your feet hip width apart. My right foot's going to be right in line with the toe of my left foot, and then I want to bend my knees slightly, equal weight on both legs, and I'm going to lift my toes on my right foot and then press the toes down into the floor. You don't want to curl the toes. You want to keep the toes straight and put pressure down. You should feel the arch working, and when you lift the toes, try to spread them as much as possible. So I'm going to do 10 repetitions on the right foot. So lift the toes and press down. 1, lift, press down. 2, lift, press down. 3, lift, press down. 4, lift, press down. 5, lift, press down. 6, lift, press down. 7, lift, press down. 8, lift, press down. 9, lift, press down. 10. And then switching, left foot forward, heels right in line with the right toe, and I'm going to lift and spread the toes on the left side and then press down into the floor. Keeping my knees bent, equal weight both sides, looking straight ahead, standing nice and tall. So lifting and press down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switching, we want to do 3 sets of 10 each foot, lifting the right toe and pressing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switching again, left foot. 1, 2, 3, lift and spread. 4, lift and spread. 5, press down. 6, down. 7, down. 8, down. 9, down. 10, down. Switch again, last set. Lifting the toe, spreading the toes, keeping the ball of the foot on the floor and pressing down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switching again. Heel is going to be in line with the right toe. Lift and spread the toes and pressing down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So that is going to be short foot. The next one is static back. You can use a chair or an ottoman. All I'm going to do is rest my legs right on top of the chair or ottoman. You want your butt to be as close as you can get it, and you want to get into a 90-90 position. So you want your knees to be bent at 90, your hips to be at 90. And I can also do this on a chair. So this is going to be a little bit higher, and this will actually put me in a better 90-90 position. So I've got my knees and my hips at 90 degrees. I'm going to set my timer for 5 minutes. So this is static back. It's a 5-minute positional hold. The arms are going to be 45 degrees away from the body. And this is a great exercise to do to help align the body. So it takes away the hip imbalance or the muscle pull on the back and the hip area, and helps to align the spine and balance the pelvis. And when you're in this position, you want to relax your abdominals. You don't want to force the back to the floor. You want it to come to a rest on its own, and just let your shoulders, your neck, and your legs completely relax, and take diaphragmatic breaths. So you want to breathe from the diaphragm, and your diaphragm is the muscle that's at the bottom of the ribs. It attaches to the hip flexor, and so you want to breathe in, expanding not just the ribs forward, but you want to expand them out. So you're breathing in, and then exhaling through your mouth. And you can take nice, big, deep breaths in through your nose, and then slowly exhale through a small hole in your mouth. So that is going to allow the alveoli in the lungs to stay open and keep oxygen in the lungs. So taking a breath in, and then all the way out. Breathing in, all the way out. Breathing in, exhale, Check in with your body, make sure that you're keeping your hips relaxed. See if your back is resting down onto the floor, and keep your shoulders relaxed. We've got a couple more minutes, so more diaphragmatic breathing, inhaling through the nose, exhaling through a small hole, keeping the lungs open, oxygenating the body. Deep breath in, all the way out. Almost done. Should be a nice, relaxing, just hold. Less than a minute to go. Okay, that is static back. Next, I'm going to do a frog position. So what you want to do is, again, lie on your back. I'm going to place my feet so they're contacting each other. My big toes are going to press in, and my heels are going to press in. I'm going to lie on my back, flat on my back, let my knees fall out to the side and relax. This is going to be just a 2-minute hold. There should be no pain in the back when you do this. So I'm going to set my timer for 2 minutes. My arms are out 45 degrees away from my body, and I want to keep gentle pressure through the heel and the big toe through this whole positional hold, and just apply that pressure. It's gentle pressure, and the feet are contacting, and you want to keep your abdominals relaxed, and you should feel a gentle stretch in the groin, and just relax in this position. Your feet should be in midline. So if you look down, your feet should be right in the body midline. Pressing your toe, big toe together, and your heel together. And you're not forcing your knees, you're just allowing the legs to relax as much as possible. And the knees gently fall out to the side. Again, taking deep breaths in this position. Remember to keep the palms up towards the ceiling. and that is 2 minutes. Then I'm going to do foot circles. So you want to lie on your back. I'm going to keep my leg that's down straight in neutral with my toes pointing up. Hold the back of the leg of the ankle that I'm going to do circles with. And I'm going to go clockwise and counterclockwise 20 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. The other direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and then plant. I'm going to point my toes. So these are toe points or point flex. You're going to point the toe, flex the foot 20 times. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Then I'm going to switch legs. My leg that is down, I'm going to keep the thigh tightened and foot in neutral, and the leg that I'm holding 90-90 position at the hip and the knee, and then starting my ankle circles 20 times each direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Switch directions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and then toe flex. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. After that, I'm going to use my strap and I'm going to do calf and hamstring stretches. So what I want to do is go onto my back. I'm going to have my knees bent. The leg that I'm going to stretch, I'm going to, for the calf stretch, put the end of the leash around the ball of the foot, and I want to bring the leg up to 45 degrees. I want to tighten the thigh, and I'm just going to pull the foot back, and you want to keep the thigh tight, and I'm just going to stretch my calf. So I should feel a stretch in the calf, and I want to stretch for 30 seconds. I'm going to bring that a little bit down lower. If you have a strap that has a flat bottom, that might be a little bit easier. And holding 30 seconds. Keep the thigh tight. Five seconds. 4, 3, 2, 1. For the hamstring stretch, I'm just going to bring the loop down to the arch of the foot, and then I'm going to keep the knee straight and bring the leg back towards me. If the knee bends, then you want to stop there. You want to go back as far as you can, keeping the knee straight, and the thigh stays tight the whole time. 30 seconds. 10 seconds. And relax. I'm going to bring that leg down, bend that knee. I'm going to put the strap around the ball of the foot, and I want to pull back to get a calf stretch, keeping the leg at 45 degrees and pulling that foot back, holding for 30 seconds. And you want to keep your hip down on the floor. And keep the thigh tight. Ten seconds. Then I'm going to take the strap, place it on the arch, and keep the knee straight so my thigh is tight. And I'm going to bring the leg back towards me, but keeping the thigh tight. That's easy to forget and let the thigh go. So keep the thigh tight and keep the hip down onto the floor, holding. Relax. So 30-second holds for the calf and the hamstring stretch. Then I want to do static extension. For static extension, you want to use a ottoman or a box that you can comfortably kneel on. I'm going to set my timer for 2 minutes. I'm going to kneel onto the ottoman. I'm going to walk my hands out. I want to shift my hips 6 to 8 inches in front of my knees. I want my shoulder blades to sink down towards the spine, and then I just want to drop my head down and just relax. So this is going to help align the pelvis and the spine. And taking deep breaths in this position. Getting used to this, sometimes it's a lot on the arms, so you can start out with 1 minute holds and build up to 2 minutes. You can even start with 30 seconds. But ideally you want to be able to hold for 2 minutes. I'm tilting my buttocks toward the ceiling, so I'm going to get an arch in my back. I'm letting my shoulder blades sink to the spine, relaxing my neck and head, and my hips are shifted 6 to 8 inches in front of the knee. There's just one more exercise after this. That is static extension. The last exercise is a wall sit, or air bench is what it is called. So I'm going to come up against the wall. I want to drop down into as much of a 90-90 position as I can get into. So I'm going to keep my feet hip width apart. I want my hip against the wall. My upper back is going to be against the wall. And I'm just going to hold this anywhere from 1 to 3 minutes. I will set my timer for 3 minutes and let you know at each minute. So you want to build up to a 3-minute hold, but 1 minute to 3 minutes is fine. And this is the last posture exercise for the Egoscue Method addressing chronic foot pain or even feet deformities, so it helps with postural alignment. And in this position, we're just going to work on diaphragmatic breathing. You don't force your arms back, you just let your arms and shoulders relax, but keep your upper back against the wall. You want the hips, and then you're going to feel your legs working and your back pressing into the wall, but you want to keep your abdominals relaxed. And then taking deep breaths in. And that is 1 minute, 2 minutes remaining. Just checking, and you want to make sure your feet are facing forward. And that's 2 minutes, so we've just got 1 minute remaining. And that is 3 minutes. So that completes the Egoscue Method to address foot deformities or chronic foot pain. I hope this is of help, and have a blessed day. Thank you.